I'm Dr. Oje, gastroenterologist, University of Abuja Teaching Hospital. Today, we're actually celebrating World Hepatitis Day. It's globally celebrated every year to bring awareness to the burden of hepatitis B and C and other viral hepatitis. So that way, today we organize head talk and awareness campaign and also screening of people so that they be aware of their hepatitis B, C status. Hepatitis are normally or just common inflammation of the liver. Anything that will cause inflammation of the liver. There are so many things that can cause inflammation of the liver, more than 100. But commonest among them is viral hepatitis, alcohol, and then herbal medications.
These two viruses have the capacity to damage the liver, making the liver lose its ability to perform its normal function. And one of the dreaded complications we don't want people with those viruses to develop is liver cancer. So that's why we're creating awareness about the disease.
Now, I'm coming down today being the World Hepatitis Day. We are actually talking more of the viral hepatitis. We have a group of viruses that can cause inflammation of the liver. They include hepatitis A, hepatitis B virus, hepatitis C virus, hepatitis D and E viruses. Now, for hepatitis A, usually is gotten by fecal-oral routes. That means from contaminated food and water. And usually they cause mild symptoms of fever, joint pains, and uriness of the eyes. And with time, they clear off. However, the most important being hepatitis B and C. These are actually what cause most and cause chronic hepatitis.
Most of our patients will just come and tell you, I don't have any complaint. I'm just here so you can check my labs and then see if I'm okay. Most of our patients do not really, like those we got early and those we're following up, most of them do not come down with complications. Most of the people we see with complications are probably those that are coming from other places being referred with complications. Those are the patients we have in the ward. The clinic, most of our patients are doing well.
Now we have this young man, 28-year-old, he's actually a youth corper. He called the mother that he was not feeling well. Within a space of 1 month, he started having a fever, jaundice, uriness of the eyes, and then stomach pain. By the time he came to the hospital, initially he went and had some herbal treatment, which actually prolonged or delayed his presentation to the hospital. However, when he presented within 1 month, we discovered he had already developed liver cancer. And of course, when somebody has liver cancer, there's nothing much anybody can do. We all know that we only have one liver, and it's not what you usually can give to another person. So unfortunately, we lost this young man within a space of 1 month. For 1 month, he was head and heady in his primary place of assignment, and then suddenly he developed liver cancer, and within 1 month, that was the end.
We see a lot of patients coming down with regrets. In fact, someone we lost 2 years ago told me, Doctor, if someone had told me what you're telling me now 5 years ago, I wouldn't have stopped my treatment. I would have continued treatment. You have a lot of people in town promising cure for hepatitis B. And if you remember when I started talking, I said hepatitis B doesn't have a cure. The fact that you have hepatitis B doesn't mean you actually be on treatment. There are guidelines for treatment. We check viral load, we check liver function tests, alpha-fetoprotein, we check some other things like we ask history, family history of liver cancer and all that before deciding on whether to start treatment or not. And once an individual qualifies for treatment, we let that individual know that hepatitis B treatment could be for life.
Now, for hepatitis B and C, usually gotten from contaminated blood and body fluids. That means anything that have to do with sharing of blood or blood products can actually give someone hepatitis B. Most common among them being sharing of sharp objects like clipper or the metal women use to knit their hair and all that. So sharing of razor, sharp object generally, or these people that cut nails. Also, it can be gotten from child to child. When children play together, one has wound, the other person is touching and all that. And that's why it's actually common in family, because as children, we share toothbrushes and razors and other sharp objects in common. Now, it can also be gotten from when you undergo surgical procedures, operations with unsterilized instruments, or if you are giving blood that is contaminated, that is not properly screened, it can be gotten. Then people who has also body tattoo, tribal marks, can also get this virus. Of course, sexual contact with unprotected sexual partner, or those who have men who have sex with men, are actually one of the other risk factors that people can get viral hepatitis.
The first step is actually to get tested to see whether you have the virus or not. If you want to know that, there are other testing we do check the titer, the level of antibody in one's body. There are labs that usually check that. So we check there's a minimum level which you should actually have. So we can actually do that if you do not know whether you are immunized or not.
After the screening, whether negative or positive, we have a table where we do counseling, where we explain this result to you. For those who are negative, we actually counsel you to undergo vaccine, because hepatitis B is vaccine preventive. So once you are negative, we advise you to go for the vaccine, and once you take the complete dose of the vaccine, it should actually offer you full immunity.
We also get people coming to tell us, when I was tested, I was given a drug and I was told to go. Everything was okay. It's not like that. Those with hepatitis B need to be constantly followed. So that's what I want people, that's the message I want people to get.
The only way one can be sure, let me just put it this way, 6-point action. 1, get tested for hepatitis. Know your status. 2, avoid sharing of sharp objects. Don't share contaminated objects. Even clippers, please get your own. Don't use unsterilized instrument for manicure or pedicure. Ensure that our children are vaccinated within 24 hours of birth. Provide them with vaccines and all that. Also, avoid risky behaviors. Avoid multiple sexual partners. And please use protection and all that. Above all, get tested, get vaccinated, and get treated. Thank you.